Hi. Oh, I can't hear you. Can you hear me?
Hi,
Hi, how are you?
good. How are things in Florida? You're in Florida, right?
I am in Miami. It's humid and today has been rainy and it's hot and terrible and sticky and no one wants to go outside.
I remember that. I lived in Miami 3 years.
You did? Did you enjoy it?
Yeah, I lived in Miami Beach and variety of locations, but I actually lived in South Beach before it was South Beach.
Ah, before it got crowded and overpopulated and fancy.
Yeah, I was right on the ocean at 7th and Ocean, and I only paid $120 a month.
Oh no, you will never find those prices here again, ever.
No, I went back there 3 or 4 winters ago, right at Christmas, and walked the old neighborhood. It was hard to believe.
I know that it's changed a lot in the last couple of years, and I was born here,
Uh-huh.
and I tend to stay away from South Beach as it is. There's a couple of places that it's a different environment, it's a different vibe. So yeah.
Yeah, back then the ocean came right up to the seawall. That whole beach was not there.
Oh, not anymore. And unfortunately, now there's a lot of flooding issues, especially during the full moon.
Yeah, yeah, I read that. Yeah, the climate change.
Yes, all of Brickell, South Beach, even a little bit of North Beach gets flooded during the full moon, and it's been a big problem for the last couple of years, where the city is trying to figure out what to do in regards to structure. They've done a couple of projects, but they've been unsuccessful, and they just keep on building and building and building, and so there's so much weight and heaviness in on the land that
Right.
it doesn't give it flexibility to rise up either. So yeah, it is. It's a very big problem. And you're in Portland?
I'm in Portland. We've had a hot day ourselves today.
Yeah, probably not as terrible as it is here.
No, it doesn't get humid here. Everyone thinks of Portland as rainy, but that's just in the winter. In the summer, it's dry as a bone here.
Well, good. So you get a little bit of balance.
Yeah, no humidity, no mosquitoes. That's what I like.
Yes, that's good.
So
That's
it's
good.
probably
So,
90 today.
oh, okay, that's
That's hot for
about
us.
average. Yeah,
Hot for us.
yeah. But the good thing is that you don't have the humidity, which weighs it down more.
Yeah, yeah, that's what I love here.
Yeah. So, would you like me to call you Robert or Bob?
Bob's fine. Yeah.
Bob. So, Bob, thank you so much for joining me today in this little project that we're venturing with FSOMA. And you're going to be at the FSOMA conference this year. Is it your first time speaking at the conference?
It is my first time attending, first time speaking. My probably 5 years since I've been in Florida. I'm looking forward to it.
Yes. Well, we'll be in Orlando. So hopefully the weather will be nice. Definitely not as crowded as Miami.
Right. But I'm going to rent a car and go to the ocean one day.
Oh, good. And the beach up there is nice. And maybe if you can take a little drive to St. Petersburg, it's also really pretty. It's very nice. Shouldn't be too bad of a drive from Orlando.
Uh-huh. Yeah, I look forward to
Yeah.
it.
And you're our sponsored speaker this year. That's so exciting.
Yeah, Blue Poppy is sponsoring the event for me.
That's amazing. And so you've worked with Blue Poppy before for a while, and you've also written a lot of articles for them. You want to tell us a little bit about that?
A regular blog and their newsletter. The owner of Blue Poppy, I've known him since December of 1995, so a very long time. We're very good friends. And I've worked for him in different capacities. Right now, I teach full-time at the National University of Natural Medicine in Portland in the School of Classical Chinese Medicine. And so I don't have much time to make available to Blue Poppy, but I do poke my head in over there every week, and I have a role in their continuing education and this newsletter that I participate in. So yeah, I'm happy that they had this idea to sponsor the talk to bring me back to Florida. As I said, I'm looking forward to it. And the topic itself is one I first presented in Israel last winter at the big conference there. And it was very well received. And it's a topic near and dear to my heart, this idea of working with sensitive and traumatized patients.
Right. So it's your topic this year is a gentle approach to treating anxiety and trauma.
Right. And this is what my private practice is full of. Yeah, I have my own clinic right across the river from the university here. And I see patients there, but I also see patients with student interns in the university health center. And many of them would fit this description. They seem to find their way to my shift. Because I've been very interested for years, starting my training in Japanese therapies would have started in December of 1999. So that's quite a long time to be at this gentler way of working. And I've trained in other styles as well. Richard Tan, I did a whole year studying with Dr. Zhu, the scalp expert. But my interests are quite broad, but I would say this would be the dominant way my practice has gone, pursuing these exceedingly gentle treatment approaches that have been developed in Japan over the years. I suspect in part because there's a tradition of blind acupuncturists there that goes back hundreds of years. And one of my main teachers, Mr. Iwashina, he is blind. I've studied with other blind teachers as well, but he's a regular for me. In fact, he'll be coming in a month to Portland again. And he's a big inspiration for me in working in this way. For 30 years, he has given up inserting needles, and his treatments are unbelievably effective. So that there's something unexplored, I would say, largely speaking, broadly speaking, in Chinese medicine about the surface energetic. But if you go to Ling Shu 1, the first chapter, and you see there are 9 classical types of needles, 2 of those 9 were non-insertive. So this is a new, weird, new age idea to just be working on the surface. This is a 2,000-year-old idea. It's true that the idea seems to have died out in Japan after the Han Dynasty. And it really wasn't until at the most 300 years ago, probably 200 years ago in Japan, a new life was breathed into these tools. First, just for treating children. But something interesting happened after the great tsunami hit in 2011, March, is that a number of practitioners went up just days afterwards and had a tent so they could set up outside these school gymnasiums where the traumatized survivors were sleeping. Mm-hmm. And they had to quickly develop, because in every facility there were hundreds of people sleeping on gymnasium floor. And what they developed was sort of a half-hour protocol that could be given very quickly, because people weren't sleeping, right? They were continuing aftershocks. They were being re-traumatized. And of course, their memories sometimes, I saw slideshows from that time. Sometimes it'd be a little boy and his whole family had been killed in a tsunami or earthquake, or a grandmother who had no family left. And of course, the trauma was profound and deep. they weren't sleeping. They had all these emotional trauma symptoms. And so a protocol was quickly developed, included some points you would expect, like pericardium 6 and some other non-surprising points, but also this protocol of stroking on the face with these non-insertive tools and also on the neck. Well, interesting is that over the SCM, or part of the SCM, that's where the vagus nerve is surface most and accessible fairly directly in a manual sense. And all this research that's been developed by, for instance, Stephen Porges, Porges, and others, Levine and Bessel van der Kolk, and it's three of the big famous authors and researchers, that there is something about the vagus nerve in particular in working with traumatized patients, and all these different vagal therapies, you might say, have been developed. But for us in our work, we discover we can be quite helpful. It's not going to be the whole answer for a patient with profound trauma, but we can prove, and I have no doubt of this now, that we are deserving of a seat at the table to help PTSD patients, that sort of thing. And so this facial stroking is part of what I'll talk about in Florida. This was developed by Funamisu Takahiro and two of his colleagues, and I've studied with him quite a few times now. So that, and we'll talk in my presentation also generally just to set context, understand that there is a real rationale for going exceedingly gentle when you're working with anxious and traumatized patients. Of course, it might make sense intuitively, but there's more to be said about it than just that it makes sense.
Mm-hmm.
And we'll look at the question of dose, a very unexplored or underexplored question, in at least in terms of my education, master's and doctoral education in TCM. This question of how much treatment to give, how do you know when enough treatment has been given, and so on. That's very important, because with these sensitive and traumatized and anxious patients, they need actually less treatment. You think, oh, their problems are profound, they need more treatment. Actually, that's not the case. They need less treatment, and they need the right dose, but also the right amount of stimulation. And so I'll try to establish in my talk a rationale for that. And I want to have a hands-on component. I'll bring sufficient tools with me so that people can maybe learn for the first time how to use a teishin. That's the Japanese name for one of these two of the 9 classical needles mentioned in a few places in the Lingshu. So we'll learn to use the teishin. If time allows, we may also be able to learn the second of those 9 needles, the round needle we call enshin. So that would be my hope for the talk, is to, again, establish the rationale for working gently, look at the question of dose, look at what do these techniques look like, so that people who come to my talk walk away being able to bring something into their practice. A word of caution is these techniques look very simple to duplicate. Actually, if you want them to work, just like if you have to practice forever needle techniques, you have to practice these techniques too, if you really want them to produce clinical results for you.
That sounds so wonderful. You know, I suffer from anxiety, and I have also had different types of trauma in my life. So when I first started getting acupuncture, I was 18 years old. Found this acupuncturist really close by, and the way that she approached me had to be very gentle, very minimal needling, because I was just so hyperstimulated already because of my emotional entanglement and my own mental chaos, that, you know, what you're saying, it does take practice to be able to hold that space and also that gentle technique with patients that suffer from anxiety and have experienced trauma, because not everyone does, have experienced trauma or understands what anxiety is. So if you've never experienced that before, it's hard for you to understand the necessity of a gentle approach. So I think that's wonderful that you're going to touch on that.
Right, I've mentioned two tools, the Taishan and the Enshin. The most important tool is the practitioner. Now what Stephen Porges is focused on is practitioner voice and practitioner facial expression of engagement.
Yes.
He demonstrated this in interesting research with infants, how infants become, in a very short period of time, I don't remember if it was under a minute or under 2 minutes, if you have the mother go very flat in her affect with the infant starts to do all kinds of things to win back that engaged face. And if they don't, then they become very quickly quite distressed. Same with going very flat and monotone in your voice. If you are used to talking to the infant and the baby, that baby talk, cooing in a very sing-songy cadence, and you drop that and go very monotone, it's quite distressing for the infant. Well, it's not much different with a traumatized patient coming into the clinic. If we don't engage, and this is part of Stephen Porges' brilliant work with the polyvagal theory, that there's in the parasympathetic nervous system a social engagement function that no one had talked about prior to him. And he's a very clever guy, really admire his work, and it has real relevance for us in the acupuncture oriental medicine.
Yeah.
That is a key piece, this how the practitioner engage the patient. I'll add, what he doesn't add is the quality of our touch. That's why I said you learn these techniques and they look simple and you think, oh, I don't have to practice this at home. Well, I was taught to touch looking for clinical information. No one told me that when I touched, I was going to be revealing myself to my patient. Not touch and not communicate at the same time. You're going to communicate your level of confidence, your level of competence, your degree of compassion. All of this is going to be communicated in your touch. And if you don't practice, it's not going to be there. And you're going to communicate exactly where you're at, and it's probably not going to be sufficient. All of this we have to practice. And if I will give one thing to the Japanese practitioner community is, as a culture, they sure understand the need for practice if you want to get better at flower arranging or tea ceremony or archery or whatever. They are amazingly dedicated as a culture, developing whatever the skill is that they're desiring to develop. And they are like that with acupuncture. They have no problem practicing moxa rolling hour after hour, needling hour after hour, Taishan technique hour after hour. They put in the time. For Americans, it's not so much a part of our culture to have that awareness. We can do that, and we should do that. And if we want to have these gentle techniques work for us, we actually have to do that.
Yes, that's true. I think also one state of mind when working with patients and being able to gauge your own energy and how your energy is being presented. Because if you internally are feeling chaotic or stressed out, like you mentioned, your patient, even though they may not be sensitive to energy, subconsciously, they're going to be reactive to you.
Yeah, that's exactly right. Yeah. Mm-hmm. Maybe the most famous acupuncturist in Japan, his name is Shudo Denmei. He's still practicing, I think, 5 days a week still. 86, I believe. I just wrote him a letter again, thanking him for all that he's contributed. He's an unbelievable human being beyond being one of the best, maybe the best acupuncturist I've seen. But he's famous for saying a number of things, one of which is your treatment shows who you are. You're going to reveal in your touch your biases. If you believe, for instance, no pain, no gain. Doing something gentle, but you really believe no pain, no gain, but I've got to do the gentle stuff because it's a PTSD patient, but I really wish I could do my stronger stuff. If that's really the way you're thinking, you're not going to get very far with the gentle stuff, right? And this will be revealed in your treatment. You'll feel like you're wasting your time. That's your bias, and that's your philosophy and your assumptions about stimulation. So, and if we have done our work in emotional cultivation, we're present with the patient, as you were describing, we've sat and are holding a safe space. All this is communicated in the treatment. And it's below the level of language, but it's nonetheless communicated. And very significant for a patient who is in trauma to feel they're safe. This is what Stephen Porges, I mentioned him. He's a psychiatrist, researcher, never really been much of a clinician as I understand his resume, but used to research at the National Institutes of Health. Now he's at the University of Illinois. Once a person is locked into that frozen trauma state, there's one question that runs through their mind when they come into your clinic for the first time, especially, and that question is it safe? They can't help but have that question, is it safe, dominate, right, their perception. They're looking because they're feeling walking around an unsafe human being, and they're looking for a secure island of safety. And use our engaged, safe facial expression, a voice that communicates that, and a touch. Again, Porges doesn't talk so much about the touch, but he has put his work out with body workers. That wasn't initially the case. And all this can communicate safety. And this is a key part of working with that patient population. Interesting, I don't know if this would be interesting, but this is how I got into this, is not by working with lots of people with old sexual trauma, that sort of thing. Is actually working with chronic Lyme disease patients. And in this case, there are two things. He said the disease itself is traumatizing because the symptoms go all over the place and they're changing all the time. And one of the things that changes all the time due to the disease is the mood of the patient. Of course, they're unbelievably fatigued. The pain is migrating all over. It's the right knee one day, then the shoulder another day, and then it's neuropathic pain another day. And it's all this crazy moving symptom picture that it just has them a nervous wreck. And it's working with them and then discovering actually the ones who had the hardest time recovering from the chronic Lyme disease were those with deep trauma in their background story, family of origin trauma or something of that sort.
Incredible.
Got me into this. I wouldn't say by natural inclination. I would be drawn to working with PTSD, but I ended up kind of in a back doorway because of this interest I had in chronic Lyme disease. I was working in the clinic of Heiner Fruhoff, kind of a famous sinologist, herbalist, philosopher, Chinese medicine, I would say. And,
yes, he's great. I'm a big fan of him.
He draws a lot of chronic Lyme patients into his clinic. And so that's where I started to get interested in this. Because I saw, even though I was working gently with needles, the more I did with moxa, the round needle, the Enshin, and the Taishin, which looks a bit like a toothpick that's metal, the more I worked with those, the better my outcomes were. And some gentle body work in the mix. For me, that's a Japanese system called Sotai and a Chinese Taoist system called Qigong Tuina. Very gentle, both of those systems. My results got better as I got gentler, and that's kind of what pushed me. The patients pushed me in this direction of trying to help as best I could. It's not the case that you can never do needles with a chronic Lyme patient. Of course, you can be helpful that way, but it's very easy, exceedingly easy to over-treat them.
Yeah.
Especially using.
Yes, and those with autoimmune conditions or autoimmune symptoms.
Right, exactly.
Same thing, yeah. It is traumatic.
Another strong interest of Heiner's. And often the autoimmune symptoms come up and conditions come up in the post-chronic Lyme period.
Yeah.
Right? They get out of the Lyme symptom picture, but they're not really well yet. They go into, maybe the headaches stay and a sort of, neurologists will speak of an autoimmune encephalopathy. But sometimes it's a horrific headache, but they're out of the Lyme picture, but they still have problems and they're autoimmune in nature.
Yeah, that's true. Well, Bob, I wish I could keep you a little bit longer, but thank you.
Give a picture of what to expect.
Yes, no, this is amazing. I really enjoyed talking to you and the way that you express yourself and just hearing about you and your life and your practice. I have truly, really enjoyed it. And I'm looking forward personally to hopefully attend your workshop. I'm going to be working at the conference, so hopefully it'll fall in a...
I'll spend some time in the Blue Poppy booth too, and I'll do free treatments on face and scalp for people if they want to stop by. There's 5 minutes of work so they get the sense of the touch and how it feels. This facial treatment, by the way, people usually look 3 years younger by the time you're done. You could market it as facial rejuvenation, but that's not really what I'm thinking when I do it. I'm trying to help their spirit more than their age.
Yeah, that's wonderful. I look forward to that. Okay. So thank you so much. I really appreciate your time and your energy, and I'll see you in person soon.
Absolutely. Bye-bye.
All right. Bye. Thank you.
There we go.